This investigation surrounds the use of remote advanced pharmacy practice experiences during the pandemic for pharmacy students. The novel coronavirus pandemic impacted all aspects of life, and healthcare systems did not remain unscathed. And as these systems prepared to care for a large number of acutely ill patients, many institutions halted on-site clinical training and education. Schools of colleges of pharmacy around the globe were faced with the difficulty of losing on-site clinical rotations and patient-centered clinical experiences. Faculty and staff at the University of Pittsburgh School of Pharmacy, alongside leadership and clinicians at UPMC, created APPE rotations to enable students to continue to progress with their clinical training in light of the pandemic. The objective of this study was to evaluate this remote APPE rotation, specifically in regards to patient-centered clinical skills, knowledge, communication, and satisfaction of the students. Fourth-year pharmacy students who were enrolled in the remote APPE rotation were included. You can see in Table 1 the daily rotation schedule. Students received de-identified medical intensive care unit charts, as well as links to educational electronic health record of 2 patients that would be experienced through simulation. Students presented the patient plan to the clinical faculty member and also their recommendations to a practice care team member, and then reviewed the simulation cases and had to think on their feet as the hemodynamics and aspects of the patient, as you can view on Figure 1 as an example, changed. In the afternoon, students received updates of their medical intensive care unit patients and developed revisions to their care plan, and they also presented literature-based topic sessions as well as journal clubs and patient presentations. There were multiple assessments associated with this investigation, one of which was a multiple choice examination of 60 complex case-based questions. We also conducted an intermittent clinical evaluation on day 1 and the final day. This was when students received a complex patient case and they had 30 minutes to review the case and develop a care plan. They then delivered this care plan to a faculty member. They were also to write a SOAP note regarding the patient and their care plan. Students also received an anonymous survey to assess their perceptions and opinions of the remote APPE rotation. All of these assessments took place on day 1 and the final day of the rotation. When we evaluated and reviewed the results of these assessments, you can see that with the multiple choice examination, students' scores significantly improved from baseline. Additionally, the verbal intermittent clinical examination presentation scores improved from baseline. And we specifically looked at multiple domains. The subjective, objective, plan, communication, and monitoring domains also all increased from baseline, as well as the written SOAP note scores. In regards to student opinion, at conclusion of the rotation, 85% of students believed that their communication was proficient as compared to 30% at baseline. Additionally, students believed that their knowledge of the critical care setting improved. They had additional comfort in caring for acutely ill patients, and overall their confidence improved. This remote acute care rotation incorporated patient-centered care, diverse patient populations, as well as interprofessional interactions. Through the use of Zoom, students were enabled to interact face-to-face with interprofessional team members as well as patient care members in a collaborative way. So in conclusion, while we know that the return to normal will happen eventually, it's most likely to be staggered, and there potentially may be roadblocks in the way. The authors believe that the schools of the health sciences should consider and invest in the creation of remote learning resources for clinical experience to continue the education of their healthcare students.